Hello, welcome to Tala Talks NICU. I'm Dr. Tala, and today we're going to be talking about the high flow nasal cannula, HFNC. If you watch to the end of the video, then by the end you're going to learn this in a nutshell. One, that high flow nasal cannula can be a great alternative to CPAP for supporting babies in a non-invasive way in the NICU. Two, babies just generally like it a lot more and they can actually orally feed on it. And three, it's probably less traumatic for the babies, for their nose and for their lungs, and probably decreases their chances of getting a pneumothorax. Honestly, that was pretty much all we're going to be talking about. So if you're done here, then please remember to like this video and to subscribe to this channel if you're interested in neonatal content. If you want a few more details, then hang around till the end of the video. Right, so as you know, a lot of the babies in the NICU need help with their breathing, whether it's getting the oxygen in or the carbon dioxide out. The high flow nasal cannula is one of the support mechanisms that we have that we can use in the NICU to help a baby breathe until they're able to breathe by themselves without any support. And you've all seen these in the NICU, the tubing that inserts into the nose with little prongs and delivers blended oxygen at a certain flow rate to the babies. I always joke with my family that if they ever want to show somebody like really super sick in a movie, like an older person, and they're like lying on their hospital bed and there's a beeping monitor behind them and the nurse has the clipboard and she's looking all concerned, then generally they'll give that patient a nasal cannula. Obviously, this isn't the case with babies at all. It is considered really quite a low amount of support for our little babies. In more detail, this is what we're going to be going over today. One, what is the high flow nasal cannula and why is it so great? Two, why should we use the high flow nasal cannula over CPAP? Three, how does high flow nasal cannula work? And four, in what situations can we use the high flow nasal cannula? Right, so let's start with what is a high flow nasal cannula. As we already said, a nasal cannula is the setup that allows a gas flow, normally kind of some sort of blended oxygen, into the nose through the nasal prongs. Obviously, it is a non-invasive form of respiratory support, which means that the baby isn't intubated. We don't have the breathing tube down into the trachea. So the air that's blowing into the nose can go down the trachea into the lungs. It can also go down in the esophagus into the stomach. One of the ways that the nasal cannula differs from the CPAP is that with nasal cannulas, we give a certain amount of flow of the gas. So we'll give like 2 liters per minute of the gas. With the CPAP, we set an actual pressure for the baby. So a CPAP of 5 or 6 or whatever. In the unit, we use 2 different types of nasal cannula, the regular nasal cannula and the high flow nasal cannula. The regular nasal cannula is also referred to as the nasal cannula that comes from the wall. And by the way, as an aside, every single time anybody in the unit says, let's get it from the wall, then I automatically think of this hysterical clip in this amazing movie.
Louder! The window! The window! The walls! The walls! The sweat drips down.
Regular nasal cannula or nasal cannula from the wall gives less support. So generally, the babies are given less than 1 liter per minute when they are on the regular cannula. Generally, this gas is also not heated and not humidified. These babies can be sent home with this regular nasal cannula. High flow nasal cannula is higher support. So generally the babies are getting anywhere between 1 to 2 liters all the way up to 8 liters per minute of gas flow. That gas is also heated and humidified, and we'll talk more about that later. And babies are generally, as of now, not sent home on the high flow nasal cannula. And just like with most types of respiratory support, you can decide exactly the concentration of oxygen that you want the baby on when they're on the high flow nasal cannula. So they could be on just pure air, so 21% oxygen. Remember, I know that you all know this, but the air that we breathe has 21% oxygen in it. So they can be on 21% oxygen all the way up to 100% oxygen. Generally, when we send babies home on low flow nasal cannula, we're sending them home on 100% oxygen. So obviously, to use a high flow nasal cannula, a baby has to be breathing pretty well by themselves and kind of opening up their lungs pretty well as well, like generating a good tidal volume by themselves. If a baby is completely apneic, then a high flow nasal cannula isn't necessarily going to start breathing for them. Same thing if the baby's lungs are really collapsed and there's a whiteout on the chest x-ray. A baby will probably need a lot more support than the high flow nasal cannula. So why is this availability of high flow nasal cannula so great, and why are we using it more and more in the unit? Well, like we said, so many babies that are admitted to the unit have breathing problems, whether they were born preterm and they have respiratory distress syndrome, or even term babies with meconium aspiration syndrome and TTN or anything else that they might be suffering from. We also know that the higher the pressures that the lungs are exposed to, the more injurious it is to the lungs. So if we took every baby that was remotely sick and immediately put them on the breathing machine, then we will really bang up their lungs with volutrauma and barotrauma and anaphylactic trauma and just badness for the lungs. So those kids are more likely to end up with chronic lung disease. We know that the gentler the support that we can give to babies, the better the outcomes of their lungs will be. And I would recommend that you go watch the BPD videos to learn more about this. But basically, our goal in the NICU is to give the babies the support that they need, so make sure that they can get the oxygen that they need in and the carbon dioxide out with the minimal amount of support that we can get away with. We've known for the last 2 decades that using CPAP is a good alternative to intubating and putting babies on the breathing machine. And we're hoping that that is going to end up with decreasing BPD and chronic lung disease. Now we're kind of going through the same thing with high flow nasal cannula. Now we're using high flow nasal cannula more in the unit in settings that we previously would have used CPAP. For example, in premature babies with RDS, babies that just got extubated that normally we'd go straight onto CPAP with, babies maybe with mild kind of apnea or prematurity that we're just trying to kind of stimulate their breathing. So it is exciting and it is promising that we have another modality of a non-invasive support to give these babies, which hopefully will be even gentler on their lungs. Right, so number 2, if we can get away with it, why should we use high flow nasal cannula over CPAP? And remember, CPAP up until pretty recently was kind of the gold standard of the non-invasive support. The first one is that, as we keep saying, high flow nasal cannula gives less support. So it's also been shown that it delivers lower pressures to the lungs. And the hopes is that with the lower pressures, then we are less likely to end up with damaging the lungs. Some studies have also shown that putting a baby on high flow nasal cannula as compared to CPAP decreases the risk of that baby getting a pneumothorax. Secondly, infants are generally more comfortable on the high flow nasal cannula. Like we said, the pressure is lower and the babies aren't being forced to breathe against it. Also, because the tightness of the seal of the nasal prongs isn't as critical with the high flow nasal cannula as it is with the CPAP, then the prongs used in the high flow nasal cannula aren't as irritating to the nasal septum and to the nose. So generally babies are a lot more comfortable with the prongs in their nose of the high flow nasal cannula as the CPAP. And I'm sure you've all seen this. The babies that are kind of fighting their CPAP and then you take it off and they're like suddenly relaxing and actually sleeping because they don't want the CPAP anymore. Also with CPAP, again, a non-invasive support, because it's under higher pressure, you've just got more air being blown into the belly. Obviously with a high flow nasal cannula, you are still blowing air into the belly, but not at the same amount of pressures. So very often when babies are on CPAP, they end up with like their bellies absolutely full of air. Their intestines are just like really distended with air and their bellies are full and rounded, and we call them CPAP bellies. That can't be really comfortable. On top of that, we often get into this kind of vicious cycle in the unit where babies on CPAP get like large CPAP bellies, so it's pushing up on their chest, so they need even more support with their lungs. So maybe we'll go up on the CPAP, maybe from 5 to 6 or 6 to 7 centimeters of water of the CPAP pressure, and then that pushes even more air into the belly, so they get even bigger CPAP bellies. Generally, we don't see as much distension with the high flow nasal cannula. And then, probably as a result of all of these, studies have shown that babies that are on high flow nasal cannula can have better infant-mother bonding, as well as improved patient and nursing satisfaction. The third reason why we may want to use high flow nasal cannula over CPAP is that with high flow nasal cannula, we can generally feed babies. Many units will feed a baby on 2 liters or less of high flow nasal cannula. When a baby's on CPAP, there's so much pressure being pushed into their oropharynx that you just really worry that the baby's not going to be able to coordinate their suck-swallow reflexes. And the fourth reason is that high flow nasal cannula is actually easier to set up than the CPAP. I'm not a respiratory therapist. I haven't personally set up the high flow nasal cannula, so I can't really speak more to this. But as you can probably imagine, because it is a more open system and that you don't have such tight prongs in the nose, then all the equipment doesn't have to be absolutely perfect for the baby. Number 3, how does high flow nasal cannula actually work? So this is the basic system, and many different manufacturers will make different forms of high flow nasal cannula and make different interfaces, which is basically the actual prongs that are going into the baby's nose. But as you would imagine, it's a system where the oxygen and the air are pumped out at variable gas flows, they're humidified and heated, and then delivered to the patient again through the nasal prongs. Generally, the gas is heated to between 34 to 37 degrees Celsius, so right at body temperature, maybe a little bit below it. The way that high flow nasal cannula works, or actually helps breathing, is multifactorial. The first way, very obviously, it can actually deliver oxygen to the baby. So like we said, you can dial in as much oxygen that you want to give along with the flow. So for example, it could be 21% or it could be 100%. I just want to add a couple of things here. The amount of oxygen that the baby receives is not just going to depend on the fraction of oxygen that you're dialing into the setup. It's also going to depend on the flow. So for example, if you have a baby who is getting high flow nasal cannula 2 liters per minute at 50% oxygen, if you then increase the flow up to 4 liters per minute of 50% oxygen, then that baby is going to be receiving a lot more oxygen. This is also true with different sized babies. So say you've got a 1 kilo baby who's receiving 2 liters high flow at 50%. And another baby who is 3 kilos who's receiving 2 liters per minute at 50%. Relatively, because the 1 kilo's baby's lungs are much smaller, relatively, that's a much higher flow and a higher oxygen that that baby is receiving. So the oxygen is dependent not just on how much FiO2 you're actually dialing into the setup, but also on the liters per minute flow, as well as the size of the baby and the baby's lungs. 2, even though we are dialing in a flow, not a pressure, high flow nasal cannulas do contribute to some sort of distending pressure. It's not as much as CPAP, but it does have some effect on keeping the alveoli open. And in this way, it does contribute to maintaining the FRC, or the functional residual capacity. The FRC, if you remember, is the amount of gas that's left in the lungs after a normal expiration. So if you breathe in and out, if you breathe out just normally, there's going to be a certain amount of gas left in your lungs that helps keep those alveoli open. You don't want those alveoli always to collapse, because then you need a lot more pressure to pop them open again. So high flow nasal cannula does contribute in some way to keeping the FRC present. But despite lots of studies, nobody's really sure exactly how much pressure high flow nasal cannula actually gives the babies. Generally though, as you would expect, the higher the flow and the smaller the baby, the higher the pressure that the baby is receiving. Generally though, if you kind of look at all the studies, generally the flow that you're giving the baby is going to be higher than the pressure that the baby is receiving from that flow. So for example, if you have a baby on 6 liters of high flow nasal cannula, then you're probably generating pressures of about 4. So kind of like a PEEP that you would have like on the CPAP of 4 centimeters of water. As you would probably expect, the tighter the prongs in the nose and the less leak there is, then the higher that the pressure is going to be generated, because obviously if there's less leak, then more of that flow is kind of staying inside the baby and not just kind of being dispersed outside of the baby. But like we keep saying, we're not trying to get the same sort of pressures that we are trying to get with a CPAP. So we do want some sort of leak around the nasal cannula. We don't want them completely snug. The manufacturers of nasal cannulas and the prongs will refer to the OD, or the outer diameter of the nasal prongs. And it's been recommended that the diameter of the outer diameter of the nasal prongs should be about half the diameter of the nostril, of the nair. So really quite a big leak around that prong. So like we said, if the prongs are really snug in the nose and there isn't any leak, or especially if the baby's mouth is shut or the baby is sucking on a pacifier, then that high flow nasal cannula is going to be generating higher pressures. So you know those times when you're going to examine a baby and you see that one of the prongs is completely out of the nose. Obviously, then this is really going to affect the flow as well as the pressure that that baby is receiving. But conversely, also be aware that with high flows, especially with really snug prongs, especially if the baby's mouth is shut, you can really generate pretty high pressures with high flow nasal cannula. So you have to watch out for the other end of the spectrum as well. The third way that the high flow nasal cannula can work and help with breathing is that it can wash out the upper airways and decrease the amount of dead space. Remember, when a patient is breathing in and out, with each breath, the air has to go all the way down the conducting tubules, the conducting airways, so the trachea and the bronchia and the bronchi, until it reaches the actual alveoli and the respiratory bronchioles where gas exchange can occur. All of this airway that isn't actually participating in gas exchange is considered dead space. So the air traveling through the tubes is not directly contributing to the breathing. But if you think about it, if you have a baby on a high flow nasal cannula, then you can get that air to move much, much faster through the dead space and therefore wash it out. And this has been shown in babies. It's been shown that increasing the amount of flow that a baby is on will actually lower the amount of carbon dioxide in their body. So here we have to assume that we are washing out the carbon dioxide at a faster rate. And the fourth way that high flow nasal cannula helps breathing is by actually decreasing the airway resistance. We know that CPAP can decrease the airway resistance by actually kind of splinting open the back of the mouth. So if you think about it, the larger the airways, then the less resistance there is to flow. It's also thought that high flow nasal cannula in its own way can decrease the resistance. It's speculated that this is done by having flow rates that are higher than the baby's intrinsic peak inspiratory flow. So basically, the flow rates that you're giving the baby are much faster than any rate that the baby would naturally generate to get that gas in. So the thought is that because that air is being pushed through the airways faster, it's helping to overcome the resistance of the baby's intrinsic breathing. This is the analogy I came up with. Imagine you're riding grass over some sort of rocky terrain with shrubs and loads of little trees and everything else. That's difficult for you. There's a lot of resistance for you moving forward. But if there was a huge pack of bikers that are like 20 meters ahead of you, that are like flattening everything down in front of you, then they are decreasing the resistance for you to move forward. It's not great, I know. And the fifth way that high flow nasal cannula helps breathing is that the heated and the humidified air really decreases the amount of irritation to the nasal mucosa as well as the whole oropharynx. It is known that delivering high flow gases to the nose and mouth of a baby can lead to drying of the nasal passages, mucosal injury, bronchospasm, and impaired clearance of secretions. So by making this air wetter, all of these side effects can be greatly reduced. Also, because the gas is actually heated, then the baby doesn't have to add any extra energy expenditure trying to warm the gas up to the body temperature. And one study has actually suggested that this results in better growth for babies that are put on heated high flow nasal cannula. I will say one thing about the humidification. Sometimes because there's so much water around, the babies can end up with these huge water dumps in their nose and the back of their oropharynx. They can choke on this, or they can just end up with like really bad kind of blockages. And this is not ideal at all. And you really have to watch out for this. Some manufacturers have devised ways to actually decrease this kind of dumping of the water, and it really has helped our babies. And number 4, in what situations do we use high flow nasal cannula? As we keep saying, we've been using the high flow nasal cannula in more and more situations. Something that I do want to point out though, Since it is less support, you don't want to just put every single kid or every single preemie baby on high flow nasal cannula and just hope that they'll fly. Our worry is that if you aren't giving babies enough support and you're not following them closely and intervening if they look like they're getting into trouble, then they could be in a way worse situation. Maybe their lungs have completely collapsed and they need a lot more support. So maybe they need intubation and very high pressures to pop open those lungs again. So we definitely don't want to put a baby on high flow nasal cannula and just leave them there. If they're on the high flow nasal cannula, we have to monitor them closely to make sure that they don't need any more support. Overall though, like we keep saying, the high flow nasal cannula is being used a lot more for RDS, after extubation, and for a lot of term diseases as well, which we have been using in term babies for a long period of time. A recent consensus by Yoder et al. Showed an agreement that if we start high flow nasal cannula, we should probably be starting it between about 4 to 6 liters per minute. Then, as we try to wean babies off the high flow nasal cannula, ideally we want to be at less than 30% where we start trying to wean the flow. Then we should be weaning the flow by 0.5 to 1 liter per minute, maybe every 12 to 24 hours, maybe even longer than that. A lot of this should also be guided not just by the FiO2 and the gases, but also by the baby's work of breathing. A recent Cochrane review done by Dr. Hodgson et al. Looked through everything that was published about the usage of high flow nasal cannula in premature babies. This is a not very funny aside, but right before we filmed this, I had spent so long going through all the high flow nasal cannula literature, kind of seeing where it had been useful, like what studies had been done, and then right before we filmed, this Cochrane review was published. And obviously it was brilliantly done, so thank you so much to the whole Australian team. It was much better than my attempt. Anyway, they pulled together all these trials and they showed that in babies above 28 weeks, there are very few trials that involve babies below 28 weeks. So in babies above 28 weeks, when high flow nasal cannula was used for RDS or after extubation, instead of CPAP or NIPPV, then there was no increased risk of BPD or death. They showed that there were many babies in the various studies that did need more support than high flow nasal cannula, but these babies didn't have an increased risk of needing intubation. They could just be put on the CPAP or the NIPPV. A little aside, remember though that this was all part of various studies. So in your unit, if you are putting a preemie baby on a high flow nasal cannula, like I keep saying, they do have to be monitored closely, as they would have been in the study. If you aren't monitoring them closely and the high flow nasal cannula is not enough support, then there is a good chance that CPAP isn't going to rescue them, that maybe they really will need the intubation and the full pressures to open up the lungs again. And they also showed in their kind of meta-analysis that babies on high flow nasal cannula as compared to CPAP had less nasal trauma, as you would expect because of the prongs, and probably had less pneumothoraces as well. So basically, we had similar outcomes with the death and the BPD with less support and less discomfort for these babies. So these really are very encouraging results. Another huge trial that came out recently, again involving high flow nasal cannula, and again by the brilliant Dr. Hodgson, was the usage of high flow nasal cannula during intubation attempts. And this was published in the New England Journal. So the way they did this study was in premature babies, and the average age was 28 weeks. If they needed intubation, then they randomized them either to being put on high flow nasal cannula, which was 8 liters per minute, before the intubation, or just continuing with whatever they were on. So they were taken off the support that they were on and then just went ahead and intubated. And they showed that the babies that were put on the 8 liters per minute of high flow nasal cannula before the intubation attempt had way more successful intubation attempts. So it was kind of 50% success on that first attempt versus 31.5% with the babies that were not given the high flow nasal cannula during the intubation. Also, as you would also probably guess, the babies that were on the high flow nasal cannula had way fewer episodes of desaturation events during the intubation process. So also really kind of like looking at what we should be doing while we're intubating these babies. Pre-medicating and putting them on high flow nasal cannula before we intubate. So in summary, there's lots of encouraging data coming out about the usage of high flow nasal cannula in the units. And then hopefully, as we all get more and more comfortable with using high flow nasal cannula, as well as all these non-invasive ways of giving surfactant, hopefully we'll finally make a dent in the BPD numbers. Hopefully we'll start seeing the rate of BPD go down. And that's all really I had to say about high flow nasal cannula. Please go watch the video on CPAP now. If you did enjoy this video, then please like it below, and please subscribe to this channel if you're interested in neonatal content. If you do write to us, then please let us know where you are. It's so interesting to us knowing where from all over the world people are watching. Again, thank you so much for being here.